Are you struggling with bunion pain and worried about surgery? Let Dr. Mitch show you 4 proven ways to relieve those bunions and possibly no surgery required.
Now, I just thought I'd talk about bunions today because the bunions is a popular subject in my podiatry practice, and I did a lot of bunion surgery, and I found that I could have avoided a lot of bunion surgery the first 20 years I was in practice because I didn't know then what I know now. And I'm going to tell you about 4 reasons why you might want to try and avoid bunion surgery. At the end, if you stick around, I'll tell you about 4 different ways that you can do that. And if I can prevent one bunion surgery today, we'll feel fulfilled. If I can help somebody's quality of life, I will be fulfilled. And yeah, here we go. The first reason to avoid bunion surgery is about 5% go south. They don't have good results. They wish they'd never met the surgeon. Some of my patients wish they'd never met me because they were worse after the surgery than they were before, for whatever the reasons. Adhesions, nerve entrapment, nerve damage, swelling, and chronic pain, and trading problems. The bunion would go away, but another part of the foot would be painful because the, during the healing process, something went wrong. And so 5% didn't do well. 15% patients will be better, but they're not really happy campers. They're not eager to have another surgical procedure because the first one didn't work all the way to their expectations. They have some residual problems that they're dealing with, and it's just didn't work out satisfactorily. But it's better than it was, but it's not great. And then the good news is about 80% of the people that had bunion surgery, at least in my practice, were happy with the results. They would do it again. And most of the time I did one foot and let it heal. And when we do the second foot, if it needed surgery, we'd do that 3 or 4 or 6 months later. And they usually came back for the second procedure. So they were happy with their outcomes, and they were happy with the progress they made post-operatively. And the really good news, the fourth reason you want to maybe avoid surgery is that I instituted a conservative management protocol a few years ago, and 85% of the people that complied with the prevention program protocol got better. The bunions didn't always go away, but the pain went away in 85% of the people. And so they didn't need surgery. They didn't need to go through disability. They they take the risk factors of the and the complications that occur sometimes with anesthesias and surgical procedures. And so they minimized their exposure to those things. They didn't have any time off work. They didn't have any downtime from exercise programs and social activities and all of that that go along with foot surgery. So that is a very good thing. It, when I learned how to do the Bowen technique, the very last day of the workshop, they said, "Here, we're going to teach you the bunion procedure." I said, "Oh, yeah, sure." They're going to teach me a bunion procedure with Bowen therapy, which is acupuncture or acupressure massage type technique. And I said, bunions are bones and joints, and you know, manipulating the soft tissue and doing a little of this is not going to fix the bunion. And so I finished the class and I went back to my practice, and I did the Bowen therapy on a large number of people over the next couple of years. And one afternoon, a lady came in with her daughter, and her daughter had a problem, and I was treating the problem. And mother said, "You know, you fixed my bunion a year or so ago." And I said, "Oh, I did." And I didn't recall the patient. I usually remember my surgical patients forever and ever, but I didn't recognize her. And I said, "Well, what do I do for your bunion?" And she said, "Well, you did that Bowen treatment for my back pain, and about a month later, my bunion went away." I said, "That's kind of strange." I said, I don't remember that either." And so I said, "Did I do the little bit around your foot like this?" And she said, "Oh, no, no, you just did my back and my legs and my neck and shoulders, and the bunion went away on its own." And I said, "Okay, that's good." So after that, I made a more conscious effort to help my bunion patients with a full treatment, including this part around the bunion for the next few months. And I said, "Yeah, they're doing better they used to." And I noticed my surgical cases went down, and it was really interesting. And I had a one patient named Tom, and he had the same problems his mother had. His mother had foot surgery about 2 or 3 years before, and she was way worse than she was before surgery. Her toes were all gnarled up and twisted and kinked, and her bunions came back, and she couldn't walk, and she had corns on her toes and calluses on her feet, and she was in bad shape, and she was concerned her son Tom was going to have the same problems as she's having. And so I said, "Sure, send him in. I'll take a look." And sure enough, he was getting bunions and hammer toes and calluses. And so I gave him the conservative protocol. And he did 3 treatments. He came back 2 years later with his mother one day because she was a regular patient. And I said, how are your feet doing, Tom?" And he says, "Oh, they're doing great." The first foot, my left foot straightened out like within a month or two after you gave me the treatments. And then my right foot, it's still straightening. He says, "I think by the end of the year, my toe will be about 100% straight." He says, "Right now it's about 20 degrees. And I think by the end of the year, it'll be totally straight." And so it was amazing that he was still undergoing a change 2 years after I'd last treated him. And I asked him if she was doing any other things for his foot, and he's no. And actually, he wasn't wearing the orthotics I made him after we got through with the 3 sessions. He didn't like the feel of the orthotics pressing under his arch. And so he didn't comply with that part of the program. But in spite of that, he was getting better and better. And so about a year later, I decided to do a little study on a group of people with bunions. And there were 66 people in the group. And out of the 66 people, 36 were surgical candidates, meaning they had pain with pretty much of everything they did. Any shoes they wore, they had pain. Standing and walking, any recreational activities, they had pain. They needed a surgery. And so out of the 36, I only operated on 6. 30 of them got better. And the average time that it took from them being pain free is about 3 weeks. Some took up 4, maybe 5 weeks, and one took 4 months, but all the rest usually were pain free within 2 to 3 weeks. And I followed them up for a year after they did the protocol, and they stayed asymptomatic and they were fine. And what was interesting is the bunions resolved in a number of people. I didn't keep track of the number of people, but a lot of them, the bunions straightened on their own, and a lot of them didn't. And what was really interesting was that a patient had bilateral bunions. One foot would straighten out, and the other one didn't. So it didn't really make a lot of rhyme or reason with the results cosmetically, but 85% got better as far as their pain. Their pain went away. And so the protocol that I follow is just 4 simple steps, and you can do those at home with a little help from your friend. And if your friend is a Bowen therapist, and you probably don't have a friend who's a Bowen therapist, so you can maybe find one. And if you can't find one, you let me know, and I'll in the comment box, and I'll help you find one. And so the first thing I do is Bowen therapy, full body from the TMJ and the parts in between, and the ankles and the feet to balance the body and get the posture realigned. And number two, I use adhesive tape, sports tape, not kinesio tape, and not stretchy tape. It's a non-elastic sport wrap tape, and it doesn't give. It doesn't stretch. It'll stretch a little bit, but not much. It holds and locks the arch in place and keeps the foot from pronating and arch from the arch from collapsing, which prevents the leg from rotating inward, and it helps the posture, and it relieves the strain on the big toe joint. The third thing that I have them do is that people do is isometric exercises to strengthen a muscle, and a little bit of the Bowen therapy to release a couple of the tight muscles, and a little other soft tissue work to loosen things up that are usually tight. And then number four, that's number three. Number four are a custom orthotic that fits the contour of the arch in the foot perfectly after the tape has been applied. A fresh taping is applied to the foot, and then the orthotic is molded to the shape of the foot with the tape on, and it holds you there, and that maintains the product. And so, yeah, you use the orthotic for long term. Intermittently can do the exercise in the home care if needed. All of the combination of those four things seems to work. And if you like this video, hit the thumbs up and the like button, and share it with a friend, because you might not have a bunion, but you know somebody that does. And if we could save one person today from a medical misadventure and the mishaps that occur with medical misadventures, we're doing a good service for humanity. And so thanks for listening to my video. Be sure to subscribe, and I'll tell you more later on.